Practical application techniques. Knowing about dressings is one thing, but applying them correctly is just as important. A good technique ensures faster healing, comfort, and infection control. In this episode, let's look at the step-by-step method of applying advanced wound dressings. Step 1. Prepare yourself and the environment. Always start with hand hygiene. Clean your hands thoroughly and wear sterile gloves. Make sure your work area is clean and all dressing materials are ready before you start. Step 2. Assess and clean the wound. Before applying any new dressing, inspect the wound carefully. Look for signs of infection, exudate, and surrounding skin condition. Then gently clean the wound with normal saline or sterile water. Avoid harsh antiseptics unless specifically indicated. Step 3. Choose and apply the dressing. Select the dressing that matches the wound's needs. Dry wound hydrogel or hydrocolloid. Wet wound foam, alginate, or hydrofiber. Infected wound silver or antimicrobial dressing. Cut or shape the dressing slightly larger than the wound edges. Place it gently without stretching or pressing too hard. Step 4. Secure the dressing. You can use adhesive film, retention bandage, or fixation tape depending on wound location. Ensure it's firm enough to stay but not tight enough to reduce circulation. For joints or mobile areas, use flexible dressings or tubular bandages. Step 5. Record and monitor. Document the date, dressing type, and wound condition. Reassess during each change to track healing progress. If exudate increases or the wound worsens, change the plan early. Correct application isn't just a routine, it's part of the healing process. Clean technique, right dressing, and careful monitoring make all the difference. In our next episode, we'll explore specialized and antimicrobial dressings and how they're used in complex wounds.